the Duke of Edinburgh has spent a second night in hospital recovering from surgery to clear a blocked artery. Buckingham Palace says Prince Philip is in good spirits, keen to return to Sandringham, where the rest of the royal family are celebrating Christmas Day today. So I can talk about this now with the royal historian, Dr. Kate Williams, and alongside her, Dr. Iqbal Malik, who's a consultant cardiologist at Hammersmith Hospital in London. And a very good morning and happy Christmas to you both. Dr. Iqbal Malik, talk us through the operation that the Duke of Edinburgh has undergone and is currently recovering from, because you've brought in some of the relevant equipment.
Well, it's an angioplasty that he had, and what that means is that we need to find out where the blockage was in his heart. So we've taken a pipe and gone up either from the leg or the wrist, backwards through the arteries, up to the heart blood vessels, and under the X-ray camera taken a picture with some X-ray dye to see where the blockage is. We reach it with one of these catheters, a great big long pipe that can go up all the way to the heart, and through that we can deliver a wire that wiggles through the clot and tries to push it out the way, and use a balloon to actually push more of the clot out the way, maybe even sucking some clot out, in fact. And then once we've done that and cleared a passage, then we need to hold that artery open, because whatever the little nonsense was that caused the problem in the first place is still there. And so we then place a stent, and I brought one of the stents with me today. And so these very thin meshwork laser cut tubes come in folded on a balloon. And once we inflate the balloon, then the meshwork opens up and stays put. We can take the balloon out, and this stent becomes a permanent part of that coronary artery, holding things wide open.
He underwent the operation the night before last. How do you know when the operation has been a success?
Oh, that's immediate, because the artery would hopefully go from being blocked or very tightly narrowed to being wide open with completely normal blood flow. So that's an immediate success, really. It's very gratifying.
And we understand that Prince Philip is very keen to leave hospital. He spent 2 nights in hospital already. When a man of 90 undergoes this sort of operation, how long would it take before he would be allowed to go home?
I think if it was an elective procedure, in other words, he hadn't come in as an emergency, then some people go home the same day. Obviously, at the age of 90, that's a little bit risky. I think 48, 72 hours later, he'd be on his way home. What we don't know is whether there was a substantial amount of damage that was done to his heart during this possible heart attack. And if there's a significant amount of injury, then we tend to keep people for a little bit longer to make sure there are no complications that can occur. Because even later on, you can get rhythm disturbances, and the heart pump may not function quite as well and may need more stabilization with medication. However, if he hasn't really had very much damage, then there's a chance that he'll want to get home for Christmas, and the doctors might agree to it as well.
Yes, well, we'll find out. But meanwhile, Dr. Kate Williams, events continue at Sandringham, and as Jenny Hill was reporting a little earlier, the royal family very keen to sort of have Christmas almost as usual.
Well, as Jenny was saying, it's a big celebration, this Sandringham Christmas. It really is a royal knockout bonanza. They're all there, 29 royals. The Duchess of Cambridge is there for her first royal Christmas ever. It's a big celebration. It's the turkey, it's the gigantic tree, it's the presents. I mean, it's the ideal Christmas, really. So they really aren't going to let it stop them. I think the idea is that this is what Prince Philip would have wanted to continue as normal. The difference is, of course, that tomorrow it was going to be the Boxing Day shoot. Prince Philip was the organiser of that, so that will be slightly different.
Yeah, you know, he will obviously be missed today, and as we know, he's keen to get back and take part in events. What is he missing? What's going to be happening?
Well, he's missing loads of fun. He's not missing the presents. That was Christmas Eve. The royal family give their presents on Christmas Eve, following the German tradition of presents on Christmas Eve. So those happen on Christmas Eve. But today, it's the church ceremony in the morning, then the great big Norfolk turkey lunch, and then after that, everyone stops to watch the Queen speaking herself. And then in the evening, it's usually a black tie dinner. So there's quite a lot of dress changes throughout the day, you know, usually about 4 or 5 dress changes. So he's missed out on that, but hopefully they took him his presents in hospital on Christmas Eve.
Yes, we understand, of course, that he's had visitors from amongst his family. Now, as you say, the Duchess of Cambridge going to be making her first appearance at this sort of Christmas special here at Sandringham. How much would Prince Philip have helped to make her feel part of the royal family at Christmas?
Well, yes, I mean, Christmas with the in-laws is always a bit terrifying, let alone when your in-laws are the royal family. So it's going to be rather a daunting occasion, and previously a lot of the newcomers to the royal family have been terrified by the Christmas. Sarah Ferguson said she had to change dresses a lot. Princess Diana, the problem was with Princess Diana was that she was too generous in the Christmas presents, because the royal family famously only like small, joke, cheap Christmas presents, so novelty bath hats, pretend Christmas crackers, pretend Wellington boots, that's the kind of thing. She bought large cashmere jumpers, which was apparently an error. But I think Prince Philip was going to really enjoy welcoming Kate, but luckily she's got Prince William to help her along the way, and apparently Camilla has been a source of a lot of advice for her, because it's going to be quite a daunting thing, I think, the big Sandringham Christmas. There's just so many people.
Yeah.
30 people.
Dr. Kate Williams, thank you very much indeed, and Dr. Iqbal Malik, thank you very much indeed for your time as well this morning. 19 minutes past 8, let's bring you up to date with the headlines, and that is our main story. The Duke of Edinburgh is expected to remain in hospital today, recovering from treatment for a heart problem, as the rest of the royal family spend Christmas Day at Sandringham.